Hi there, welcome to a short video on screening during the COVID-19 pandemic. So my name's Dame Vishnubala, I'm the Chief Medical Officer for Basketball England. So I'm going to go through some key concepts around screening to complement the return to play document. A massive thank you to Andy House and Charlie Ford for reviewing these resources that I'm presenting today. So let's talk first about screening. And then following on from that, we'll talk a bit more about the process, and then finally we'll talk about the equipment that's needed as well. So let's start with screening. So firstly, let's try and explain the difference between stratification and screening. So risk stratification is when we try and recognise that someone is at higher risk. Therefore, if they get COVID, the outcomes are going to be worse. They're not going to do very well. They might end up in ITU. There might be a higher risk of death. So these are really important people to identify to make sure it's appropriate for them to return to sport or return to the team in terms of staffing or coaching. So ultimately, if they understand they're at higher risk and recognise it, then we need to make sure they understand the risks and the benefits that that might afford them in order for them to make a decision around whether they should return to sport. So this is called informed consent. And ultimately, the person doing that informed consent won't be us, and I'll talk you through this a little bit more in the next slide. In terms of screening, well, screening is about identifying those who might have a COVID-19 infection. Now, by identifying these people, we can stop them entering the gyms and the centres and therefore infecting more people. So screening needs to really be done at every visit. And therefore, when screening is done at every visit, we're not just asking them their symptoms, we're also checking their temperature. Anything that's positive, so therefore it's a yes, they must be sent home, signposted to NHS for testing, and to isolate. And again, the government has changed their guidelines. Initially, the isolation was 7 days, it's now 10 days, so bear that in mind. And please do recheck at the time of watching this video to ensure what's the correct government timescale. Therefore, both risk stratification and screening are incredibly important towards creating that safe environment to play basketball in. So the risk stratification itself, you'll find this in Appendix 4 of the Return to Play. Now I've placed the actual image here as well, and these questions are about you and your household. So if you answer yes to any of them, or your household answers yes to any of them, then ultimately you are at higher risk, or your household is at higher risk. And this is important. If you think you're at higher risk because you have read this statement, then you need to speak to a healthcare professional such as a GP to decide if it's safe and appropriate for you to come back. And it's only that healthcare professional that can give you the appropriate advice for you to make the decision as to whether it's right to come back, not the club. So the club must signpost that healthcare professional. Now the club needs to circulate this risk stratification around so everyone has looked at it, members wise, coaches wise, and made sure that they're not a yes for anything. If they are, they need to make the COVID officer known that that is the case, and they need to get some advice from a healthcare professional. And ultimately, it's up to the individual member to then make a decision as to whether they want to return, understanding those higher risks. In terms of screening, well, as we said, screening is incredibly important to stop the spread of COVID. Now, ultimately, we're going back in many areas towards more contact now, which ultimately means that there are implications to this. So really, we need to be very clear that someone hasn't got COVID symptoms. So in terms of screening, if they've answered yes to any of the questions, that's a recurrent cough, if that's a loss of taste or smell, or any symptoms of a temperature, or the temperature check is positive, so that's 37.8 or higher, then these are positive symptoms. You must turn the individual away. It's very black and white. Avoid them having any contact with other people and signpost them to NHS testing via the NHS website. If they appear unwell in any way, then use 111 as a signpost as well. In terms of governance and information security, well, the COVID-19 officer needs to make sure all the information around screening is kept and it's kept secure. For example, it should be in a locked, fireproof cabinet with secure access. If it's going to be stored electronically, then it needs to be end-to-end encrypted. So your average kind of basic password protection isn't usually good enough on free software. So do check the capabilities of what you're storing it on and its security. And it's the club and or organisation's responsibility to ensure that its GDPR and data protection regulations kind of compliant and they're followed to the T. So ideally, if getting rid of any records, which you can do after 21 days for the daily screening, don't just place it in a bin. It needs to go in a confidential waste, so a management team to collect it away, or you need to use a cross shredder ideally. So let's have a look at the actual process itself in a little bit more detail now that we've kind of done the overview. So in terms of screening process, so you should be carrying this out outside. Remember, players can stay in their cars if the weather is, particularly inclement. So just think it through. If it's cold, if it just doesn't make sense for them to stand in long lines, advise that they stay in car. You could stagger it. You could come up with sets. So group 1 comes to screen first while group 2 wait in the car. They could have staggered arrival times. However you guys feel that it's most appropriate in order to protect your players in general, that's fine. So you need to carry that out. On top of that, on the table itself, screening, so screening likely to be done in a car park farther away from the main entrance. There should be a table there that might have a screening documents as shown here. It might have cleaning wipes, it might such as Clinell hand, it might have hand sanitizer, and remember the person delivering it needs to consider who they are, what PP they have, and we'll come back to that as well. There should be signage and posters all around with key messages around symptoms, the way they should behave, and what the rules are of the building as well once they go beyond the screening. Preferably there'll be a one-way system in and out of the building. So in terms of setup itself, so make sure the screening table is far away from the entrance of the leisure centre or basketball court or gym. Make sure it's probably a part of the car park that you can section off. Make sure players and staff are queuing at 2 metre plus intervals. And remember, staff need to also be screened as well. So work out how you're going to do it. You might get the staff screened first so they can crack on with planning the sessions and getting all the kit ready while the players are then coming in for screening. If you've got large squads and you might want to stagger a start, you may want to consider having more than one staff member manning a screening station. So you might have 2 queues running so you can get through the screening twice as quick. So up to you again, depending on your capacity. So staff involved in screening should be wearing level 2 PPE, so we'll come back to that. So that should be a mask, a visor, an apron and gloves. Staff screening should be asking the symptom questions from 2 meters away or more. Some clubs have said that the people are going to bring a sheet with their symptoms already on it. That's up to you, that's fine. If staff are doing it, make sure you're 2 meters away, but you've got to reinforce and ask the questions again to verbalise it. So I think it's important to still repeat it. Finally, you can then do 2 things. You can get the individual to take their own temperature, or you can take the temperature. If the individual's taking the temperature, they need to hand sanitize first. They then need to use the infrared thermometer and place it a couple of inches above their forehead and take it. Then they need to wipe it down again with a Clinell wipe and put it down. It needs to be 20 seconds at least before the next person picks up to allow for drying so that there's no risk of spread. Now the other option would be that the person manning the screening station in PPE, so all the stuff we've talked about, asks their symptoms from 2 meters plus away, but then comes just inside, so it'll be 1 meter long with an arm reaching a bit, ideally just from the side of the individual, and takes their temperature, and then quickly moves back out of range, so 2 meters plus, the moment that temperature is taken. And that can be done very quickly with an infrared thermometer. So both are reasonable options, and both have their pros and cons. The cons of the staff member doing it is that they're regularly coming closer to someone, so their risk theoretically goes up. So again, you can mitigate that by making sure that all the players and team members in the queue are all wearing face coverings. You can mitigate that by checking the questions first, and if the questions are positive, you don't need to do the temperature, you need to send them home. Or of course, you can mitigate even further for the staff member by making sure they don't take any of the temperatures and the players take their own. But there's a risk with that, because if they don't clean down the thermometers properly, there's a risk of them passing something on to the next individual in the queue. So just bear that in mind. So again, pros and cons. You guys as a club need to make that decision as an organisation, weighing or taking into account the different options available to you. Okay. So again, I will leave that with you. The key thing is if someone is positive, they need to be moved away from the area quickly and should make contact with no one. So here's a diagram showing how it could perhaps work. So obviously they're going to queue 2 meters apart plus. Remember, this isn't like the supermarket where there are signs on the floor but no one's actually following 2 meters. You need to make sure that it is very clear, and all I can reiterate is ideally get across this information by email, text, so on beforehand, so everyone knows what's expected of them when they turn up. But also be clear that you will enforce those rules, and I think that's incredibly important to ensure the reduction of the spread of COVID. So again, making sure that you're clear about the rules and making sure that you have people in place that can help enforce that for you is incredibly important. Ideally, I would say that all people in the queue should be wearing face coverings at all times unless there is a medical reason not to. If the screening shows a temperature or symptoms, so therefore there's a positive screen, they should be sent home immediately, isolated. Remember, that's now 10 days, not 7, but do check the latest guidance when you watch this video, and also advise them to get a test. Now, if they're negative, they can come in. There should be no congestion, so no kind of milling around of people in the entrance. There should be a nice flow of people 2 meters apart at the minimum, in order to make sure, again, that we reduce the spread. So my advice to you would be, try and walk through the route as a dry run, see what you think, see where you think the pinch points are where there might be too many people, see what they're likely to touch. How can you reduce the risks further? Now the screening document, well, you can see here the screening document that we're using. Of course, clubs are entitled to take this and make this a singular piece, so every player drops in a sheet with their information. I personally don't like that approach. I think the reason being you're now transferring an item to another individual. I think it's better if the screener records all the temperatures and all the symptoms on one sheet. They control the pen and it's not being swapped about. So my advice would be that the person who is in charge of the screening that day is writing down all the symptoms, the names and the temperatures. Remember, the symptoms are persistent cough, loss of taste or smell, or a temperature, and the temperature is 37.8 or above. Okay, if they're positive for any of it, do send them home. Remember, it's isolate, get a test. Okay, let's move over to equipment. So for equipment, there's 2 types of thermometers. We have advised that you buy an infrared thermometer. So that's the one on the left. Infrared requires no contact, so from a couple of inches from the forehead, you just press it once and it tells you the temperature. You can do that an arm's length, which means you can get almost close to a meter away from someone, which is quite a good place to be. Whereas the tympanic membrane, slightly more accurate, however you do need to be making contact with that individual. There are probe covers, so plastic covers you put on top have to be changed in between, so there's a cost element to that. So there's something to consider again in terms of what you're going to do. The tympanic membrane is slightly more accurate, however we're using infrared in healthcare settings now a lot, so I would argue that in a non-clinical setting it is more than reasonable. Now if you are really want to be cautious and about the risks of thermometer accuracy, then you can do as we've discussed in previous webinars. The infrared thermometer is very good if it's negative, so they don't have a temperature, it's very accurate. So you can trust if someone is negative, they can go in. Theoretically, there is a slight risk potentially that the reading that comes up on infrared is not the accurate reading, so it might show temperature when there isn't. In that case, it is up to you. You have 2 choices. One is to just send them home anyway because you have a low threshold and that's important. If you feel they're really hot, they've just run here, there's been a very good reason why they might be like that, you could sit them on for 5 minutes away from everyone else, make sure an appropriate setting, and then you could retake the temperature. But bear in mind, once you start to go down this route, you risk the possibility of congestion and people milling around who now are potentially milling around with temperatures, which increases your risk. So do think very carefully about how you're going to manage that flow. Alternatively, other people have suggested, which is very reasonable, which is if the infrared shows a positive, that they will then use a tympanic membrane and take that temperature and they will use that as the most accurate temperature. If that's high, they'll send them home. If that's normal, they'll let them go in. That's fine if that's what you want to do as a club, but remember, sometimes simpler procedures are better, and therefore you may decide potentially that one infrared reading is all you're going to do, and if that's positive, they go home. So up to you guys. I've weighed up the pros and cons for you there. You must take a temperature, and ultimately if the temperature does show high and you can't back that up with a second reading or a tympanic thermometer, they have to go home. Okay, so I will leave that up to you, but it would be very acceptable to just do a one-off reading with infrared thermometer, and if that was high, it'd be very acceptable to send them home. Ultimately, there will be 1 or 2 people we send home that don't have COVID. They might have a temperature for a range of other reasons. However, this is a public health crisis at the moment, and it is better to send 1 or 2 extra people home now and again than it would be to let them come in by mistake. In terms of PPE, there's lots of different levels of PPE. So for the majority of people, so if you're not playing, so coaches and a range of team members should be wearing either a surgical mask, or they can wear a 3-layer face covering. So it's a 3-layer face covering, and there are lots of face coverings out there and face masks out there that are cloth based, but make sure they're 3-layered to provide adequate protection. Now level 2 would be goggles, because you've got to cover your eyes, because you can get transmission through eyes, not just nose or mouth. It would be a face mask, it would be a plastic pinny that's disposable, apron, and then it would be gloves as well. Now you could wear a face visor. Face visor is great because it protects the eyes instead of the goggles, but it also protects your mask and gives you an extra layer. So up to you, you can do both those. Level 3, if you are employing healthcare professionals such as sports therapists, physios or doctors, and they've had appropriate training, you may want to check what they're going to be doing. If they've got an FFP3 mask and all a full gown, everything else, they may wish to keep and use that in case of emergency, such as for CPR, but that would be a discussion for you to have with that healthcare professional, and depending on their indemnity, their own training, they may or may not be able to do that. In terms of PPE details, so face shield, I'm a big fan of it. It's very easy. It's basically a bit of perspex and ultimately plastic. Ultimately, it's got a foam bit that sits on your forehead, and it's just elasticated over the top. Now it protects your eyes, but it also protects your mask. The face shield is not an equivalent to the mask. The mask itself protects people around you from you and only gives you some protection. And it's other people's masks that if they wear it, that it protects you. So just bear that in mind. It's all about everyone wearing face coverings and masks. Face shields add an extra layer of protection. On their own, if you wear a face shield, it protects you to some extent because you're the wearer of the face shield, but it doesn't protect people around you to the same extent that a face covering does. Now you can see here's a surgical face mask. So there's a blue layer on the outside, which you can see here. And the blue layer is basically your repellent layer. So if there's droplets and things, it doesn't get absorbed through. The other 2 layers are absorbent layers. And it's been designed to, I guess, stop you getting those droplets in. So the blue layer has to be worn on the outside. And I'll come back to how you wear and use these in another video. Again, because we're in non-clinical settings, I think apart from the screener, I think it's very, very reasonable, and I would argue more appropriate to wear a 3-layer face covering that's cloth-based. You can wash it, it's better for the environment, but also the level of cover difference or protection difference in a non-clinical setting in terms of risk is pretty low. Now I'd argue that face covering does it just as well, and I would use it myself. So that gives us a quick overview of COVID-19 and screening, so I hope that's been helpful. And as we go through, no doubt as things change, we will keep trying to add resources to try and support you. Of course, keep feeding back how you're getting on with things as well, and hopefully as time goes on, based on your feedback as well and with new evidence as it emerges, we'll keep making this process better and better.